Good morning and welcome to the 13th Advocates and Allies webinar. Advocates and Allies are a series of webinars aimed at building the capacity of community mental health workers to build advocacy skills to support people as they navigate a complex service system. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today all over the country. I'm on the land of the Cabrogal clan of the Darug Nation, and I also acknowledge that the land I'm on was also accessed by people of the Dharawal Nation. And I pay my respects to their elders, both past, present, and future, for they hold the memories, the culture, and dreams of Aboriginal and Torres Strait Islander people. I recognise and respect their continued relationship and connections to land, water, and culture. I'm also delighted to take this moment to announce that MHCC has begun the preliminary planning for our second Innovate Reconciliation Action Plan. And we look forward to developing and eventually implementing our action items. We'll be calling out for EOIs for First Nations participants to join our advisory group in the coming weeks. I also want to begin by honouring those with lived and living experience of mental health challenges. Your insight and expertise are integral to shaping our work, and we deeply value your contributions. I also stand in solidarity with those who choose to remain silent about their mental health struggles, recognising the courage it takes to share or to quietly navigate these experiences. I would like to just provide an alert to participants today that we will be discussing matters that some people may find distressing. I urge you to do whatever is necessary to take care of yourself, and there are a list of contacts that the team will place in the chat shortly, should you need to access them. So in terms of opening up the webinar, the loneliness is, or generally loneliness is recognised as a public health concern due to the profound effects it has on persons' well-being and health. Loneliness knows no boundaries. It can strike anyone regardless of their circumstances. It can affect someone standing amidst a crowd of friends and loved ones, or it can touch those who spent much of their life living alone. It can impact a student in the playground feeling isolated because they're being pushed out of their friendship group, or an elderly community member with no visitors to share their days. It is a universal experience that we all need to acknowledge and address. People experiencing mental health challenges have reported disproportionate levels of loneliness, with the New South Wales Mental Health Commission's 2021 Community Wellbeing Survey finding that 51% of people living with mental health challenges experienced loneliness compared to 37% of the general New South Wales population. The recent New South Wales inquiry into the prevalence, causes and impacts of loneliness conducted by the New South Wales Legislative Assembly Committee on Community Services was welcomed by the New South Wales mental health sector. Since the inquiry was established in August 2024, public submissions have been invited and closed, public hearings have been held, and the committee is now in the process of preparing its final report. The committee received 146 submissions, including some contributions or a contribution from MHCC and two of our member organisations, Relationships Australia and Lifeline Australia. We are pleased to have both organisations presented here today by two sector leaders, Elizabeth Shaw, the CEO of Relationships Australia, and Dr. Amanda Brooks, Chief Research Officer at Lifeline Australia. We'll also be hearing shortly from the Honourable Dr. Sarah Kane, MLC, Committee Chair of the Loneliness Inquiry, who will share some of the inquiry's initial findings and the recommendations being put forward to government. We look forward to hearing from our speakers about loneliness and social isolation as they affect people living with mental health challenges, and discuss the impacts of these experiences on individuals, carers and kin. If you do have any questions throughout the presentation, please drop them in the Q&A function, or you can drop any comments in the chat, as I can see people are already starting to do. We'll try and answer as many as possible during our dedicated panel session. It is now with great pleasure that I welcome our first presenter, the committee chair, the Honourable Dr. Sarah Kane, MLC. Dr. Kane is a political academic and trade unionist. She was elected as a member of the New South Wales Legislative Council in 2023 and is the chair of the Standing Committee on the Social Issues, which held the inquiry into prevalence, causes and impacts of loneliness in New South Wales. Her background is in economics and industrial relations and as organiser at the ACTU. Dr. Kane, thank you very much for joining, and I'll hand over to you.
Thank you very much for having me. Let me just check that I can manage the technical side of things, which is always the first challenge.
Thanks, Dr. Kane.
Okay, brilliant. Thank you so much again for having me, and thank you all for the interest that you've shown in this issue and for the excellent submissions that we did receive to our inquiry. So as we've already mentioned, this was the inquiry into the prevalence, causes and impacts of loneliness in New South Wales. So what was it about? The committee inquiry was about prevalence, vulnerable populations, contributing factors, physical and psychological impacts, existing initiatives and steps to reduce the impact. We're yet to report our findings. That'll come probably early next month. But what I want to talk you through today is what we heard, who participated, and really what the next steps are, and happy to take questions on that. The terms of reference, as with anything, we take a broad view. So we made sure that we didn't exclude anyone or any organisation if they wanted to bring us something that we didn't know about, or perhaps didn't know that we needed to include in the terms of reference. And I guess in trying to hold an inquiry about something like loneliness and social isolation, it's really hard to come up with terms of reference that are going to cover everything. And it's also going to be really hard, just knowing that we're in the drafting of the report, to come out with really useful recommendations. What are sort of the policy implications and the useful recommendations? So that's where the real thinking has to be done, following all of the excellent contributions. So as I said, this was the terms of reference. We had 146 submissions. We had a lot of interest in this space. We had individuals tell us their lived experience about social isolation and loneliness. We had the government and public sector, and across the range of levels of government. So we had New South Wales government, different agencies present. We had the City of Sydney present, had some really interesting approaches to facilitating public spaces where people can meet. We had sort of government mandated advisory councils, etc. So that was the sort of the government. We had a number of really important health and mental health services, as well as NGOs, and we've already heard that the other speakers today, Relationships Australia and Lifeline, were some of the not only the submissions but the witnesses that we heard from during the inquiry. We heard from academics and research institutions, and this for me, I mean, all of the witnesses were excellent. I just found some of, maybe it's being an unreformed academic, some of the research that's being done I just found really fascinating. And I guess from a policy point of view, moving from framing what the issues are and the types of experience people had to thinking about what could be done, I really felt that some of the academic research really suggested to us the types of initiatives that we could be considering, the types of government policy that should be considered. So I felt that it was a really good follow-on from the experiences that we'd heard from individuals and from organisations that assist individuals experiencing loneliness and isolation. Of course, advocacy and professional bodies, including, I presume, some of the organisations that might be listening, but also, very importantly, community and not-for-profits. In terms of community organisations, as I said, we haven't finished writing the report yet, but it came out loud and clear from the evidence, both in the submissions and in the witnesses that appeared, that loneliness and social isolation are types of experiences that really, things that assist them are very locally based. So community organisations that are very close to individuals that people can access easily, came out as being a very important part of the puzzle in terms of the types of activities, the types of organisations that are helpful in trying to ameliorate loneliness and social isolation. We had at the hearings, I think we had, just looking at my lists now, we had, I think, well over 50 different organisations and individuals give evidence, and we did conduct a regional hearing out in Orange, where we heard from regional neighbourhood centres. We heard from Lifeline again, but their Central West service, organisations like the Rural Women Cooperative. We heard from really interesting evidence from someone who is the coordinator at the Department of Primary Industries and Regional Development of regional workforce planning initiatives, which are, to say they're a concierge service for public servants who go and live regionally, underestimates what they're about, but they do a lot of linking in of new arrivals in regional settings with the community to make sure that they don't very quickly end up feeling socially isolated. And that was a really fascinating day, and I'm really pleased we did go out and get that regional perspective as well. So what did we hear? Well, we heard a lot, and I tried to sort of stage the hearings sequentially, if that's possible in an issue as big as this, but really to kind of try and understand the concepts and experiences that we're talking about. So we really did get people together first and look at the definitions and understanding of loneliness. And the discussions that came out were about loneliness being a subjective experience, that perceived gap between desired and actual social relationships, but that it being quite distinct from social isolation, which is that sort of objective lack of social contact. We also had quite an interesting discussion over various days and various witnesses about loneliness itself not being a mental illness, but that it can be closely linked to mental and physical health outcomes. And I'm sure we have many, many people on this seminar today who have a lot of experience in understanding that much more deeply than I do. But it was a really interesting discussion about the link, but also the differences, and also that idea of transient loneliness. We do all feel loneliness at some times in our life, but when that morphs into something more long term and potentially more destructive for our mental health as well. We did hear, and I was quite fascinated about this from a researcher's point of view, we heard about the populations who are most affected by loneliness. And what we heard was almost every population. So there seemed to be a particular, and I know we've got researchers, and I know Dr. Brooks is speaking after me, maybe she'll have some views on this as well. We seem to have quite a few researchers who use the same data set but cut it differently. So there was a lot of reliance on the HILDA statistics and the survey that gets done periodically. And then there were some organisations which conducted their own data collection on, I guess, the prevalence of loneliness and came up with different cohorts who more experienced loneliness. So we had some research and some evidence that told us that older adults, especially those living alone or in aged care, were most likely to be impacted or most likely to experience loneliness. We had other evidence and other studies show that young people, particularly those who've been infected by COVID-19, although I suspect that's also the period that the research was done. Also young people who, I guess it's that intersectionality argument, young people who are experiencing other, had other compounding factors such as alternative schooling or unstable housing, also more likely to experience loneliness. There was a very powerful sort of set of evidence, suite of evidence maybe is a better way to describe it, from carers who really, really vividly described the experiences of people caring for others with mental illness or disabilities. And I think a very particular type of loneliness and sort of acute factors that contribute to that particular set of circumstances. We had some really interesting organisations that have particularly focused on culturally and linguistic diverse communities, including recent migrants and refugees, and the types of services and activities which can ameliorate some of that loneliness in that group. We did hear, again, very powerfully from LGBTQ plus community and individuals where stigma and exclusion, again, those sort of layers of intersectionality also played out. And we did hear about men, and in fact we had a number of submissions from organisations, Men's Advocacy and Men's Service Organisation, describing the experience of particularly older men and those experiencing life transitions like retirement or divorce. And we did hear in the regional hearing from other organisations which spoke about that, but also, I guess, culturally, the types of barriers that men face in admitting to loneliness and taking steps to reconnect in terms of social connections. So they were the. So I said it was quite an interesting cross section, and I guess it makes sense. That loneliness is a universal experience. So it makes sense that we were hearing about the different ways it manifests across different cohorts and different demographics. So that part of it did make sense. In terms of contributing factors, we did hear about the stigma around loneliness, and I think I've got in my notes stigma around loneliness and mental health, but I actually think there's a difference in this, in that I think there's the stigma around mental health. All of the types of people I imagine who are on the call now have done amazing work in not getting rid of, but at least allowing mental health to be a topic that can be discussed publicly. I think loneliness is a different subset, and I think it does still attract a stigma that's a bit different to mental health. And that's what we did here in our evidence gathering. We also heard about digital transformation, and the over-reliance on online interactions can reduce meaningful contact. We also really heard, and this is, again, the type, I guess, hints at the types of things that might assist in overcoming social isolation and loneliness. We heard about urban planning and housing policies and how we, the spatial aspects of how we live particularly in a modern city that discourage connections, that discourage multi-generational living and community interaction. Cost of living came up all the time as a reason why people can't engage in the types of way they'd like to with some activities, and that makes complete sense. And also particularly regionally, transport, lack of transport in regional and rural areas. Impacts of loneliness, again, I don't think on this group I need to go too much into this. Increased mental health issues, high risk of chronic physical illness, greater likelihood of substance abuse and suicidal ideation. And of course, for me, I do mention them last because they're important, but the impact I think on individuals and society is the greater concern. But of course, there are economic costs on the health system and productivity losses, which have been estimated, and you all would have read these reports, at about $2.7 billion annually in Australia. So effective interventions and solutions, and this is really where our thinking is at now. Okay, we've had all this evidence, we've had fantastic contributions telling us what loneliness is, how it might occur, who's impacted, and then what are we then thinking of in terms of effective interventions and solutions. And as I mentioned previously, what came out loud and clear for us was that community-based programs, men's sheds, view clubs, CWA, youth hubs that provide safety, inclusive spaces, libraries are really important, community centres are really, really important. For being places where people can go and make those meaningful connections. We heard a lot about social prescribing, linking individuals with community activities to health professionals, and it was interesting, and we're unpacking that a bit because there were different views for and against social prescribing, but it certainly came up a great deal as a potential helpful intervention. As I said, neighbourhood centres offering that sort of low barrier to entry, place-based support, social connection, and we know, and I know, and I'm sure there's people on the line who know that they do such work on such shoestring budgets. Peer support and mentoring programs, particularly we heard in that sort of men's health, men's services space from programs like Mentoring Men, about helping build trust and resilience and break down some of those cultural barriers about reaching out and I guess being vulnerable with each other. Digital inclusion, ensuring older adults and core communities can assess and navigate online services. Yes, that was part of it. We also took some fascinating, a little bit divisive on our committee, but some fascinating evidence about the potential use of AI. Now, as someone who is very much about the importance of human contact and valuing our the workers in any of these socially important areas, it's a bit confronting to think that there might be a role for AI in ameliorating loneliness, but there was some really interesting evidence, which I think it is at least worthy of consideration as an additional means of intervening for individuals, particularly at that older age, those with dementia, etc. Really, really, really interesting evidence on the built environment and potential sort of interventions about designing public spaces that encourage incidental social interaction, but also really interesting evidence about lonely-genic environments, the importance of green space, and the types of things which intuitively I think we all know are good for us in terms of the physical environment that we live in, but that also need to be considered more, particularly when it comes to social connection. And I guess in terms of the policy recommendations, we heard suggestions to develop a whole of government strategy that across, I guess, all of these aspects that I've just mentioned. So health, housing, transport, education, investing in early intervention and you know, the types of organisations, again, that we've just spoken about are exactly the types of organisations that are important for early intervention before people start to feel those deleterious effects of being socially isolated or lonely. And also simplifying grant processes. I know this is the case for small, particularly not-for-profit organisations. It's always an issue how much of your resourcing you spend actually trying to get the resources. And so that's significant consideration. Support for carers who are one of the most impacted cohorts, and also that tackling the stigma, as we have done with other things, about normaling conversations about loneliness, and raising public awareness. And I've got to say, after not seeing the reliance on one set of data, I really think we should be better at data collection and that research piece. Not better in terms of the researchers all doing a great job, but in terms of making sure we get exactly the kind of data that helps us pinpoint what's going on and be able to better target any interventions that we do think are useful. So that's pretty much it. The next steps are that the committee will report later this year. I'm hoping that will be next month. What happens with a report of this nature is that the committee gives the report, And while I am a member of the government, the committee is separate to the government. It's a cross-party committee. It's a social issues committee in the upper house. We tend our report. It gets tabled in Parliament. The government gets 3 months to respond once the report has been tabled. And myself and other members of the government, of course, will continue our discussions with the government, so me with ministers and others about this issue, but also other stakeholders. And very happy if there have been any of you on the call who want to chat further, for you please to get in touch with me. And I think that's it. As I said, I know we've got a question and answer session at the end, so very happy to take questions then.
Thank you so much, Dr. Kane. Yes, we have got quite a number of questions. So I look forward to asking you those questions during the panel. So thank you very much for taking the time to join us as well as present on the preliminary findings to date. I'm now delighted to introduce our member organisation CEO, Relationships Australia CEO, Elizabeth Shaw. Elizabeth Shaw is the CEO of Relationships Australia, as I said, and they are part of a federated network across Australia. It is the foremost organisation in relationship wellbeing, assisting New South Wales through the provision of therapeutic, trauma-informed support, mediation, education and family safety services. Elizabeth is a clinical and counselling psychologist who has focused her whole career on how people live and work well in relationships and communities. She has authored a number of publications in relation to relationships, clinical practice, organisational life, moral courage and ethics. And I'm delighted to introduce Elizabeth. Welcome.
Thanks, Evelini. It's really great to be part of such an important conversation. And certainly as I start my comments, I would like to acknowledge that I'm in Macquarie Park today, which is Wallumattagal land, and pay my respects to elders past and present, and also acknowledging any First Nations people who are participating in this important event. So just a brief word about Relationships Australia. If you have not known a lot about us, that we are about 77 years old now, and are often known most for our flagship services in couple and family counselling. But in fact, over 77 years, like any relationship, we've grown and changed a great deal. And we now provide services in 3 main strands. So one, which I'll focus on a bit today, which is our life transitions work, where people will come to us at a particular hurdle or transition. So it may be trying to find love, it may be navigating a changed relationship, it may be taking up role as a single parent, maybe becoming a parent, commencing the process of retirement. So a lot of those sorts of transitions will raise issues for people, and they will seek advice as it reverberates through their relational system. The second main area is when there is a significant disruption, such as separation and divorce. We have a whole suite of services that are related to that, involving undertaking parenting plans or property settlements, but also children's contact centres for people needing supervised access to their children, and a whole lot of group work programs that are to do with that life stage, as well as education generally. And then the third area, some of our services focus more on trauma. We have a large suite of services focused on domestic violence, elder abuse, and for specific communities such as stolen generation, forgotten Australians, people who've experienced forced adoption and forced migration. So we do a whole wide range of things, and that's the context that I'd like to talk to you today. Oops. So just to put up this definition, what I want to draw your attention to is the relational component. It's the obvious component, but loneliness is all about disconnection. And it doesn't necessarily mean that you don't have relationships, but it means that even within those relationships, you have a sense of disconnection and a greater desire for something that's a more satisfying interpersonal experience. And so I think this is very this is just very important that we talk about loneliness, but we talk about that loss of relationship or the absence of relationship, which is really what people are defining. It's not about being literally alone necessarily. And for some people, you know, over the years of my career, I've had people say to me many times that being in a relationship that is empty actually feels much lonelier than being entirely alone. And I think that's always been a very poignant reminder to me that a relationship that's not meeting your needs is often extraordinarily painful and can bring up feelings such as shame, might make you feel ungrateful. You know, I've got this, what looks like a great person, or I seem to have a great social circle. Why do I feel so bad about it? Is sometimes also just hard to explain. I think what we do is we often rush to simplistic commentary around this. Like even with a friend, we might say, well, get a hobby, or, you know, meet new people. And so I think it's I think it's often our own discomfort that loneliness sounds like a painful and rather shameful experience, in which case we rush to some glib responses about this. And in fact, if it was that easy, then people would have worked it out already for themselves. So I want to just talk to you about this Harvard study of adult happiness and health. It's one of the rare longitudinal studies over 84 years. And really their summative statement was that it's all about good relationships. And so that in some ways encapsulates everything. But if we break down this sentence, then we need to emphasise the good relationships. And all of us would define what is a good relationship very differently. So what we know, though, is that loneliness can literally shorten your life. And so then, most significantly in this conversation, that relationships will be your single greatest predictor of life happiness. Therefore, why aren't we investing more directly in relationships? So what our work really tells us is that life transitions are going to exacerbate loneliness. There may be already a sense of feeling lonely, and then when there are losses or disruptions, that's only going to make things worse. So obviously some of those life transitions, as I mentioned, could be becoming parents and losing work, at least for a period, and being more on the home front. It could be a literal death in the family. It could be a loss of a role, such as through redundancy or retirement, or it could be in our global economy moving, which everyone greets with excitement. This is going to be a great thing, but it leads immediately to social disconnection. And we have now got some studies that even the online work experience, while it could really beef up our pleasure in flexibility, can also be very problematic for our mental health. So let's dig a bit deeper into relationship breakdown. So what we see is that when there is a disruption, say through separation and divorce, or through grief and loss, and you know, bearing in mind that loss can be sometimes where you still have someone physically present but psychologically absent, such as a partner or a family member who is experiencing dementia or an acquired brain injury, for example. Sometimes the person you have is not the person that you once had. And so there can be complexity and nuance in this. But if we look at then a significant relationship shift and these sorts of effects, I just want to note some of them. So when you think about that loss of emotional intimacy and connection, and the day-to-day experiences of that, which include suddenly not having a ready person to have a social life with, someone who no longer has that day-to-day routine, someone who gets into a queen-size bed alone for the first time, There's something about the very visceral experience of trying to do life alone, which in itself can feel incredibly confronting. The identity that one has as partnered or a daughter or a mother, to feel like that identity, which is reinforced through the presence of another, is lost, can feel incredibly confronting, and people can almost have an existential crisis of, well, who am I now? Because we generally define ourselves in relation to others. We are in role with others and we take part in life with others. So without those significant others, we can suddenly feel like how we hold ourselves upright and alert and moving through life has also changed. We might carry what we again quite casually call baggage. That baggage can feel like a big bag of rocks that weigh us down, trying to make sense of the loss, trying to make sense of who we are, how we took part in that loss, how we move forward with confidence when perhaps we've been robbed of that through the way the ending occurred, can mean that we have work to do. The thing is that our friends and family, if we're going through any form of grief and loss, want to rush us on. They will be the ones who think, hasn't it been ages since that giant disruption happened to you? Isn't it time to move on? Isn't it time to take up the reins of your life? Other people will rush you onto dating apps or social groups as if you feel fine and ready. At the same time, that could bring up another wave of relational questions, such as, well, I feel socially unskilled now. I may be quite advanced in my life. I may have worked and had other friends. But when it comes to deepening connection or creating more intimacy in my life, or in fact finding new friends that fit my social circumstances, I don't know how to do this. And I had this experience recently when I was speaking at a peak body event that was working with older Australians, and we were talking about relationships in later life. And I had members of the audience say, if you ever run a social skills group, I'd love to come to that because I think I've forgotten how to make friends. And these were people in their 70s and 80s. And again, I think it's a reminder that you don't sort of develop skills and then they're just a set and forget. We can have kind of the guts taken out of us when we have had a different experience, and we need support. And often it is a professional service such as Relationships Australia who stick out the distance with us. So I often find with my own clients, they say my friends and family have got sick of me talking about this. I need someone who can actually tolerate being with me for as long as this takes. And I think the reverberations over time can be considerable, not for everybody, but certainly can be very powerful. We just heard some mention of high-risk populations, and I've just listed so many there you might think, well, maybe I'm talking about everybody. And that is because, as has been said, we can all experience loneliness and for different reasons at different times, and it can be quite short-lived. It may be a bit confronting, but not necessarily impair our lives. But there are other people who experience it very powerfully. For example, those who've experienced separation, men in particular, in the 6 months after relationship breakdown, can be at much higher risk of suicide. In the 2 years post-separation, women can be much more at risk of significant harm as a result of domestic violence. So we know that people can become quite literally unhinged in a whole range of ways past such a disruption. But let's take into account some of these other groups. For example, young people who are arguably the most connected generation can feel both better and worse as a result of social media, and can judge themselves very harshly in relation to what others appear to have. So can be very at risk with their mental health. And as I said, the homework environment doesn't serve younger people well, so research is telling us now. Single parents, and in particular single dads, can be at risk of great loneliness. I think it's really, a powerful reminder that separation and divorce is so ubiquitous. You can think, well, we've almost just got to expect that there's going to be constant turnover in our lives, and it's so normal that we don't need to focus on it. I certainly have spoken to single parents who in their child's class there is no one else who is a single parent, or they're a member of a church where no one else is a single parent. So I find it quite shocking myself because I guess it's the industry that I'm in. But it's such a good reminder, I find, that for every life stage change, you often need a whole new group of friends. I've certainly spoken to many older people, just to look at the other age spectrum, who retire. And I've had many people say to me, I keep meeting people that just want to talk about their grandchildren, and I most certainly don't. Not because they didn't love their grandchildren, but they said that's not the identity I want to take on. I actually want to hold my identity as someone with, skills and knowledge and interests and other things to do. We know that transgender people have a much, much higher risk of loneliness and a higher risk of suicide as a result. So I think in all of these areas, and we'll be talking about domestic violence a bit later, and you can, see here obviously people who are culturally and linguistically diverse. If their English isn't as strong, they can be extremely isolated. So I think we just have to remember that if we're going to look at service responses, how do we take into account responses that are not homogenised, are not that quick fix, find a hobby, join a group, because for so many that would just expose another barrier. And certainly we have found that we have started a service. For example, we were looking at issues for young people with disability, and we were running particular sorts of groups for them. And what we found is, although the group wasn't about this, they said that the greatest benefit of the group was meeting other people. So I think how we just gather, how we could think about people gathering and having a meaningful experience together is a challenge, but also such an opportunity for us to think about, because many of our services, if they're provided in the right format, could tick a number of boxes in relation to loneliness. So these are some of the things that certainly we would be recommending and can talk about a little bit more. I think we've got to see loneliness as a very significant social problem. This is not a few people, and it's not just the elderly. And in fact, the worry about saying it's the elderly is also to write it off, that that's what you get when you get older, as if, you should just sort of suck it up and get on with it. I think we've got to say this is a pervasive social problem, remarkably common. At least 1 in 5 are going to experience it to a very significant and potentially impairing degree. So how can we actually ask about this a bit more in routine screening about people's social networks? Because fundamentally, there is no service that is going to be able to meet people's needs. Knowing they have some sort of social network, such as a neighbourhood set of connections, is going to be critical. As was just talked about, we need to look at grassroots initiatives. It's not about professional services. Not only there's not enough of them, it can be inaccessible for a whole variety of reasons, and only takes you so far. Who you live with and who you engage with is going to be much more protective in the future. We need to be able to normalise social connection in a positive way. If we talk about a service or an initiative to combat loneliness, lonely people are not going to turn up to it necessarily because it's just too shaming. So how can we be creative? How can we gather people in groups that is empowering, uplifting and engaging, and doesn't require so many social skills that someone would feel like, I almost need the initiative before the initiative to even be able to get to step 1. We talk a bit about social prescribing. I feel very ambivalent about this term, but I know it's the term of the moment, because my fear is that the medical model, which really has failed mental health so significantly by thinking an expert can bestow on another a range of recommendations, I feel like the narrative falls into that sort of category. What I would prefer to talk about is being curious about people's social experience and to ask about their social world and what matters to them and how they'd like to feel visible and wanted and valuable to others, and how we could talk about that experience. I think social prescribing might sound shorter, but I worry it will be another set of quick fixes that the person on the receiving end is just going to feel unable to access. So let's dig into that a bit more. We certainly do need to be more nuanced around the populations that we look at. And we do need to understand this as a social phenomenon more because, you know, as was said, in our highly connected worlds, how could this be that we struggle in this way? So I guess what I'd like to leave you with is that, in fact, how we consider intimate, familial and social connections is going to be, you know, very much a part of the way forward. And we'll talk a bit more in a bit.
Thank you so much, Elizabeth. Lots of information and a wealth of experience, and I appreciate you taking the time as well to join us today and sharing what Relationships Australia recommends in terms of a way of moving forward and also just your practical experience. So thank you. I'm now moving to Dr. Anna Brooks, who is the Chief Research Officer as well as Government and Stakeholder Relations Executive for Lifeline Australia. She's an exceptional research leader and communicator, having served at leading academic institutions in both Australia and Switzerland. Her role at Lifeline Australia is to leverage partnerships with leading experts to generate strategic new knowledge as it pertains to suicide prevention and mental health, and translate that knowledge into Lifeline services and evidence-based advocacy. Welcome, Dr. Brooks, and over to you.
Thank you excuse me. Thank you very much, Evelini. It's wonderful to be here, and thanks to MHCC for hosting such a terrific event. I don't know if I'm pleased or feeling slightly intimidated to follow up on two terrific talks. Thank you very much, Sarah and Elizabeth. Really interesting content, and I hope to pick up on some of the threads from the discussion points that you both have raised. As I speak to loneliness in the context of what Lifeline delivers in terms of services across the nation and our experience of supporting people in distress. To begin, I'd like to acknowledge that I'm on the lands of the Wangal people, where I'm based here today in Balmain in Sydney, and I'd like to pay my respects to Elders past, present and emerging. All right, to begin, I'm going to speak to loneliness. I'm also going to sort of reframe that a little bit as I'm going to speak about the value of human connection. I'm going to move along on my slides. I'm going to do that by speaking a little bit about paucity and the consequences of having low levels of human connection and related sense of belongingness. I'm also going to speak to the converse of that, having an abundance, and what that looks like and what that means for people's mental health and well-being. I will then provide an overview of the Lifeline model, hopefully share a little bit more about how it is that Lifeline operates as a national service. We have 43 centres across the country, 17 based in New South Wales, which is the subject of the loneliness inquiry, as Sarah mentioned, the geographical area that the loneliness inquiry was focused on. I will also speak to some of the recommendations that our organisation made to the loneliness inquiry based here in New South Wales. So hopefully that gives you a little bit of a roadmap of the subject matter for today, and really look forward to the discussion section at the end as well. So let's get stuck in. So in terms of human connection, and I know we've discussed this already, but I do think it's worth reinforcing what we're actually talking about here in terms of not loneliness or that paucity of human connection, but also exactly what human connection is all about and the value that it can bring. So human connection, as we define it, is the sense of being valued, seen and heard by others, and really importantly here, and I'll speak to this more when I sort of draw the link between loneliness and risk of suicide. What human connection provides, or is as a predicate for, is a sense of belonging. Okay, so a sense of belonging is incredibly important, in all respects, but has a particular significance when we come to that discussion about, known risks, stressors for suicidal thinking. Such as the importance of human connection that, speaking on behalf of Lifeline, as I sometimes have the privilege to do, actually speak to it in terms of being a fundamental wellbeing pillar. So, sleep, good sleep, good nutrition, movement, and connection, human connection, and the associated sense of belonging, often frame as being absolutely fundamental to being, to being well. Now, Elizabeth, thank you. You mentioned that Harvard study. Another way of putting this is that good relationships keep us healthier and happier. So, I think from various different sources, this theme's coming through loud and clear about the significance of human connection to our, our very well-being as humans. So on the converse, on the flip side, loneliness is the distress or discomfort stemming from a perceived lack of human connection and associated sense of belonging. So, and what we know from the data, and as Sarah mentioned, there's various different data sets that are cut in different ways, but we know that loneliness is prevalent. If we use the Ending Loneliness Together report, 1 in 3 Australians report being lonely, 1 in 6 being having a significant impact on their lives, their level of loneliness. So it's prevalent, and it's associated, and it causes distress and discomfort and a range of other consequences that stem from it, including a basic sort of health related ones that I'll speak to a little bit more in a moment. But key again here is that sense of belonging is in deficit for people who are lonely. Now, sort of framing, speaking to the paucity sort of aspect of when it comes to human connection and some of the consequences. I won't belabor these because I think everyone on this call is probably well across the sort of some of the key themes and findings that have come through in the literature. But speaking to it briefly, we know that that lack of human connection, lack of belongingness, and loneliness are associated with a significant range of with a number of health and mental health issues, including premature death, high risk of cancer, high risk of cardiovascular disease. The US Surgeon General spoke to it being equivalent, health-wise, negative impacts on health of smoking 15 up to around about 15 cigarettes daily, high risk of chronic disease, depression, social anxiety, and indeed, as Michael popped in the chat, a recent meta-analysis, again drawing the link between a positive association between loneliness and risk of suicide. So a range of factors, very significant ones that are associated with loneliness, lack of human connection. And in particular, if we focus on suicidal thinking, as I'm sure most of you are aware, Lifeline is an organisation that is focused on suicide prevention. For 62 years in Australia, our organisation has existed to ensure that people don't have to face their toughest moments alone, with a view to helping prevent loss of life to suicide. So this is our focus, and this is the link, sadly, that I'll be drawing today between loneliness, or that lack of human connection, and suicidal thinking. Now, in terms of suicidal thinking, what we know from the literature is that it's often the consequence of a unique combination for everyone. It's a unique combination of stressors and protective factors that determine risk of suicidal thinking and indeed loss of life to suicide. Some of the key sort of elements, and here I'll be speaking mainly to one of the most influential models of suicidal thinking that's available at the moment, the IMV model by an academic called Rory O'Connor and his colleagues. I'm happy to provide a link to it if anyone's interested for more information. But that IMV model speaks to key elements that typically are involved in suicidal thinking. So typically there's the presence of feelings of defeat, humiliation, and entrapment, and a lack or a paucity of a sense of belongingness and human connection. So here you see that really important, that significant importance when we consider risk of suicide, of the concept of a sense of belongingness. So again, just to possibly belabor the point here, a lack of belongingness is a risk factor for suicidal thinking. So, sort of, it's a complex. Suicidal thinking arises from a complex sort of interplay of different factors, but oftentimes that lack of belongingness is something that's present in people who are experiencing that thinking. So, having looked at some of the, what the data tell us about a paucity of human connection and that sense of belongingness, I'll now speak a little bit about the flip side of the coin, about what it looks like when there's sufficient human connection present in someone's life, or indeed in abundance. So just the converse of many of the things we've already talked about. Healthy blood pressure, is one of the key factors we often see when that social connection's high. Cardiovascular health is better, higher immune functioning, higher mood, better sleep patterns. Some of the sort of mechanisms via which having good social connections actually affect our physical health also include, some of those really basic biological mechanisms include a better regulated sympathetic nervous system, and the HPA axis, which is often referred to as the sort of stress axis, the sort of mechanism that's responsible for cortisol release from our adrenal system, so that HPA axis is typically better regulated in people who have good social connection, and that's the sort of one of the bases for reduced inflammation and so on and so forth. So at a very basic neurobiological level, having good social connections has an impact upon us, and the converse is also true. When we don't have that human connection, that sense of belongingness, we see a less well regulated sympathetic nervous system and HPA axis. So, having spoken a little bit about what loneliness or lack of human connection and belongingness means in terms of suicidal thinking, and in terms of health and mental health more generally, I'd like to speak a little bit about the Lifeline model, how it is that we contribute as a service provider nationally to supporting people in distress, and also addressing loneliness for a number of people who use our services. So this is an overview of our general approach to providing service across the nation. We offer not only, as you'll see there on the right, I'll just move my window around a little bit, but we offer a range of different types of services. Most people know us for our helpline suite, which includes 13 11 14, 13 Yarn, 13 Help, and 13 11 15. Now, 13 11 14 is the voice-based service, 24 hours a day, 7 days a week that we provide. It's the sort of original Lifeline service, and from there we've spread our wings over 62 years and added additional helpline services there. 13 Yarn, I hope many of you are aware, is a voice-based helpline that is by and for Aboriginal and Torres Strait Islander people. 13 Help, a service that is tailored towards people who've experienced natural disasters. We also have our text and chat services, which are helplines available, as the name suggests, via text and chat. So those services directly address crisis support, which you'll see on the left there is sort of in the middle in the dark blue blob. So those services are designed to, in the case of 13 11 14 chat and text, as universal services available with very low barriers to entry, to support people who are in crisis, in distress, or doing it tough in any way. Now, we've deliberately framed it, framed the service the way we speak about it, to provide a wide open front door. So if people don't know where to turn next, then our helpline suite is available for them to reach out to without an appointment, without having to disclose any personal information. Our crisis supporters are highly trained and ready to meet people in the moment to de-escalate crisis and provide support in that moment, and also to provide, where appropriate, additional referral options. So that sort of covers to some degree our crisis support suite. Very happy to answer questions, further questions if there are some in the panel discussion. But we also, it's sort of less well known that we also do a lot of training. So we do accidental counsellor, DV alert, and we also have a self-support toolkit available via our website. All of those, I guess, mechanisms are designed to help us have impact in the prevention space. So we have a focus on reducing risk factors and strengthening protective factors, you know, as regards suicide prevention. And then we also have postvention services. So we do work, and this is often via our community programs that are offered via our centres that are based in metro, regional and rural areas across the nation. We offer programs like Eclipse, which is an aftercare service. So it's specifically for people who have attempted suicide, and that's offered out of a number of our centres. It's an 8-week closed group support program. We offer suicide bereavement supports as well, and our Connect services, which I'll speak to a little bit more later, which I'll speak to in a little bit more detail later. So that gives you a bit of a sense of the suite of services that we offer from the under the Lifeline umbrella. Just zeroing in particularly as regards the links that I drew previously around belongingness, suicide risk, and loneliness or lack of human connection. Our crisis support suite, the sort of original services that we provided, and the ones that still sit at the very heart of all that Lifeline does. There are sort of 3 key objectives that underpin our approach to supporting people via our helplines. They're to provide psychosocial support. They're to engage in crisis intervention, so de-escalating the crisis for an individual in the moment. And they're also about befriending. Now, to put that another way, the framework that our crisis supporters use, the people on the phones, the chat, the text service, is called the CARE framework. It's a Lifeline developed approach to supporting people who are doing it tough. CARE has, you know, so it's an acronym, and it's what CARE as an acronym refers to is connect, attend to needs, reaffirm and empower. Now, connect comes first for a very important reason. Our crisis supporters, before anything else happens in that sort of contact with someone who's reached out to the service, spend whatever time it takes to make sure that they're meeting the person where they're at, that they're connecting with them, that they're making sure that that individual feels heard. Now, that's a really key element to this sort of befriending objective that I'm noting here, and what that's essentially doing is laying the foundations for that person, you know, for that interaction to be one that provides a sense of connection and a sense of belongingness. So via our, you know, one of the fundamental sort of pillars of our approach in the Helpline service suite, we are actually addressing, you know, that need for a sense of connection and a sense of belongingness. And we do that via our crisis support services between 3,000 and 4,000 times a day, every single day of the year. That's the sort of volumes of people that we're supporting via those services. This is just a little bit more about impact. So, you know, in a typical year, the voice-based service will, you know, have, you know, between, you know, around 1.1 million people reaching out for support. And in terms of text and chat conversations, over 30,000 times a year will be, 70,000 times a year will be providing support via those platforms as well. So, you know, I guess in terms of impact via our Helpline suite, it's a significant number of people that we're supporting each year, but also just a reminder that we provide those community programs as well. So making sure that we're offering a wide variety of supports to people who are doing it tough across the nation. In terms of our recommendations, so hopefully that gives you a bit of a sense of how it is that Lifeline supports people who are in distress, and the scale to which we do that. In terms of our recommendations specifically around loneliness, we spoke to the inquiry about sort of 3 key areas. I won't belabor the point here. We're happy to share the submission with you if you'd like to sort of read in further detail what we as an organisation were suggesting to the inquiry. But broadly speaking, we spoke about the importance of promotion, specifically, awareness raising. This is something that as an organisation we do a lot of. We're very fortunate, privileged to have a significant platform with the public and with policymakers, so our social media typically gets really great engagement from people across the nation. So we're sort of, we spoke to the importance of raising awareness, public education, that work around, and both Sarah and Elizabeth mentioned this, that work around stigma reduction. Also just making, I guess, encouraging that conversation about what does loneliness look like, and, and what are some of the steps that we can take as individuals, but as also supporters of individuals experiencing loneliness to address it. So promotion's a really key aspect of what we recommended. We also spoke to prevention, especially focused on strengthening social infrastructure. We talked about some of the really encouraging evidence around addressing the built environment and looking for opportunities to better sort of address opportunity, I guess, to create more opportunities for incidental contact. So more, sort of social spaces where people are, likely to convene or sit down for a break in the park and actually be, have that opportunity to have an incidental, contact with another human being. So encouraging social connection via the way that we actually, address infrastructure in the nation. We also spoke to intervention. So, and our key recommendation here was funding evidence-based interventions that work together with local communities. So, things like, arts programs, but also really importantly, volunteering opportunities. Now, obviously I've got a vested interest in this because, as some of you are probably aware, our crisis support service, in terms of the voice-based service 13, 11, 14, for example, 70% of that service is actually delivered on a volunteer basis. So incredible Australians, highly trained crisis supporters who give up their time because they're invested in having a meaningful, positive impact for their fellow Australians. And from that, as the evidence sort of suggests, from those volunteering opportunities, the individual who's actually engaging in those opportunities, there's benefits for them as well in terms of their social connection, their sense of purpose, another really important protective factor when it comes to suicidal thinking. So, guided by the evidence base as to what works, intervening to actually, making sure that we're funding programs that support intervention such that, when loneliness does arise, we're able to address it, in an effective and evidence-based way was our third and final recommendation. And that really wraps me up. Thank you, Evelini. Terrific to have the opportunity to speak to Lifeline and what it is that our network provides across the nation in terms of support, and also really excited about the panel discussion. And thank you very much for your time.
Thank you so much, Anna, and thank you for sticking to time. I know there's lots to cover in short 20-minute presentations. If I can now ask the fellow panelists to join, Dr. Sarah Kane, if you can come back on, and also Elizabeth Shaw, if you can come back on. We do have quite a few questions, so I'll try my best in the next short while. We've got till 12 o'clock, and I'll try and get through as much as I can. And if we can get you, Anna, to stop sharing screen, that would be great. All right, while that is happening in the background, I'm going to start off with an easy question for you, Dr. Kane. Did you hear any evidence from any First Nations organisations? And I'm going to try and combine some of these questions to get the essence of what's being asked across. Did you hear about any intersections in the hearing about loneliness and autism and those with neurodivergence? So it's First Nations, autism and neurodivergence, please.
I'm just pulling up my notes. We didn't have anyone specifically from a First Nations organisation, but we did have organisations for whom First Nations communities are they're engaged with, so regional community centres. But I can stand corrected on that because there were 149 submissions, but we had more, I guess, of organisations based in communities with First Nations, larger First Nations populations, rather than from First Nations groups themselves. With regards to autism, we had, from memory, and you'll forgive me because I've been running simultaneous inquiries through this committee, so it's magic. We did have submissions from memory from autism, those with lived experience and advocacy groups. So we did take evidence from that particular experience.
Great, thank you. I'm going to ask you a slightly harder question, if you don't mind, Sarah.
Yes.
Bearing in mind the disappointing progress towards acting on recommendations from the inquiry into equity, accessibility and appropriate delivery of outpatient community mental health care in New South Wales, that was led by Dr. Amanda Cohen, what expectation do you have that the government will support your recommendations from this inquiry? We seem to be really good at doing inquiry after inquiry, and getting the recommendations implemented from these inquiries is always the bit that matters, I guess. So just interested in your views on that.
Yeah, I mean, there'd be a couple of points I'd say to that. First of all, I think, and this is for me because I'm relatively new to being a politician. I'm not a career politician. I was an academic, and then before that, I was an activist. So I think sometimes for those of us from the outside, we have varied expectations and maybe unrealistic expectations about the speed of anything that comes out of policy making, government agencies. So whilst not making an excuse, I do think, and I have that, and I suffer that being on the inside, I'm very impatient for things that I want to see happen. So I chaired an inquiry into the social potential of procurement, so how we spend our money to get better social outcomes. And so I spend, and through no bad will on anyone in my government's fault, but I spend a lot of time chasing ministers down corridors with, the recommendations from that in my hand, saying, oh, we said we do this, when are we doing this, how are we doing this, what can I do to it? So I think there's also a sense sometimes that if a recommendation isn't, because we are very cynical about politicians, I think there's often a sense that, well, someone's blocking that. There's some political thing and often it's not that. It's what's been prioritised for the day, what's hit the desk on the day, who is advocating is important. So I think there are reasons why things don't happen as quickly. I can't remember exactly when Dr. Cons, who I work with very well, she's on this committee on another issue with me. We're looking at the impact of harmful pornography, and she and I are working very closely on that. I can't remember exactly when it reported, but we've only been in government for 2 and a bit years. So the inquiry, I'm imagining, would be a year old maybe. The government gets 3 months to respond. So without, and not at all wanting to make an excuse, because I suffer from incredible impatience about us moving forward. I think we can sometimes underestimate how much time things take. So that would be my initial answer to that. With regards to this inquiry and any findings we make, any recommendations we make, I think there's a couple of things about this inquiry that will make it hard, being absolutely frank. Loneliness, we've just heard from experts, not from me, I'm just receiving the experts' information, but we've just heard from experts about the layers, the complexities, the individual kind of characteristics and factors. And so trying to tie all that together into sensible policy decisions is tricky. It's not to say that there aren't some, and I think I indicated where some of those might lie, but that in itself will make it hard to come up with perhaps as many as we would think interventions. What I can say to, I'm not sure if anyone asked that question, what I could say is I see my role as an enthusiastic backbencher as literally being an internal advocate for the things that I think are important. So I can't speak yet to what the minister will say. Obviously, I've had conversations with her. So Rose Jackson is the minister, very active in this space, very concerned, very interested. But but I can't speak to what her response will be when the recommendations come out. What I can say is, as I have with other areas, is I do see my role as not being handing something over. I'm invested. And so it's a question of, these are what we think, based on the evidence we've heard, these are the things we think could help in this space. What can I do? What do we need to be doing? So I can't tell you that the government will agree with everything that comes out of our report. I don't see that as the role of my committee, is not to provide the government with an easy tick. It's to provide some thoughtful policy recommendations, which, if I care enough to have in my report, I also care enough to follow up when we're done. I can't guarantee that every minister will always agree with me. They don't always agree with me. But I see that as something that will be an ongoing action required of me.
Thanks, Sarah. I guess we're really lucky to have you agitating from the inside and, trying to influence for the change that we need. So thank you very much for that. Elizabeth, I've got a couple of questions for you. I'm getting direct questions as well as questions in the Q&A and in the chat. So forgive me while I try and consolidate some of these. From your experience, Elizabeth, what is the connection between domestic and family violence and social isolation and loneliness? And how does your organisation support affected individuals?
Oh, look, there's a very direct relationship through a number of different means. So one is the shame and stigma, that although, again, a very commonly discussed topic, we're much more open about domestic violence and it's unacceptable, that I think a lot of victim survivors still struggle to come forward, and often, again, connected with their identity. They often think, well, someone with my background, my job, my profession, my role, it's particularly shameful for me, whatever the circumstances might be. So they can find it hard, which means that they can be isolated. The abuse itself can keep them very isolated because social isolation is a strategy to make sure that possessiveness and control is maintained. So again, I would have seen many people over the course of my career talking about being friendless, and in fact, examples where people have been entirely cut off from their family through strategies to make them feel bad about maintaining those connections. Again, the follow-on corollary of that is that lack of self-worth and also the lack of practice in having other relationships, the lack of being able to benchmark your experience against that of others compounds the problem. So there's so many different ways in which social isolation both reinforces abuse tactics and ensures that recovery takes that much longer. So, sorry, your other part of the question is, what do we do? So this is an area where, for example, one-on-one work is good because you have the particularities of a situation, but group work is absolutely foundational. So we run a program called Women, Choice and Change for women who are affected. And again, they know that everyone in that group has exactly their experience. So there's that sense of relief that they're not pathologised. They feel validated and recognised through their experience. And so often friendships will emerge from that. But equally, we have a series, we're one of the biggest providers of men's behaviour change programs, and men who do not traditionally sit in groups. And in fact, when we suggest that the intervention is in part in groups, they are very nervous about that, thinking, well, what am I going to sit and talk about with other men? But what we find is that being able to talk with others who share their experience, not to reinforce it or to collude, but just to, in fact, test, challenge and understand each other, is an incredibly powerful way of delivering services. So they're just some examples of ways in which we run a program, but it has this really important secondary benefit.
Thanks, Elizabeth. And I know MHCC held a Meet Your Neighbour event in Lithgow last month, I think it was, and they kept talking about men, and the focus was on men's mental health, and they kept talking about walking shoulder to shoulder with men, not in group sessions where you have to sit in front of someone. So there's just a different way of working with different cohorts. There is a question here from Elizabeth, and not you, Elizabeth, a different Elizabeth, but the question is for you, Elizabeth Shaw, and the question is, does Relationships Australia plan to employ mental health peer workers to harness the invaluable insight that those with lived experience can uniquely offer to someone who's struggling with mental ill health?
Oh, look, absolutely. We're, as a provider that sits a bit outside the mental health system, this is work that we are getting more directly involved in, and absolutely are looking at that. It's very important for us that staff and service design reflect the communities we're involved with. And we do a lot of co-design with the communities that we serve. Some examples that I don't know if we might go on to talk about, you mentioned the neighbourhood sort of work, Evelini, that Relationships Australia nationally runs the Neighbours Everyday campaign. And we've also run some work in disaster affected communities. Through both of those grassroots campaign, we walk with people to design things with local community leaders, people who don't see themselves as leaders. They might run the tuck shop or be the soccer coach or whatever it might be. That what we do is we actually work with people in the community who are either of the particular groups or can advise us. So we do a lot on the run in quite informal ways to co-design as well.
Thank you. We might go to Anna for a few questions. Although only 4% of callers explicitly state loneliness as their reason for calling crisis supporters, supporters note that note it as a major factor. How does Lifeline address this underlying issue in its crisis intervention strategies, given the nature of Lifeline's work?
Thanks, Evelini. So yes, so in terms of the specific, in terms of loneliness being associated or identified as the specific reason for calling, the numbers are quite low. But I'd note importantly that 40% of our contacts to our crisis support services relate to relationships. So I think Elizabeth, you spoke about the that key element of life transitions. That is, in terms of relationships and changes in relationships, it's one of the most common topics that people speak to our crisis supporters about, and those changes often, sadly, are breakdowns in relationships and associated feelings of distress, but specifically feeling lonely in the family, breakdown, feeling that loss of belongingness. So whilst loneliness might not be often sort of, I guess, reported by the crisis supporter as the key reason for calling, associated factors are in terms of struggles with relationships is a really prevalent topic of conversation with our crisis supporters. So just a little bit of context around that. In terms of how our crisis supporters respond, essentially, the basic framework for that they are applying, whatever the topic that the person using the service wants to speak about, is the same. So that care framework that I spoke to earlier, which is, it gives the crisis supporters, I guess, basic steps that they cover in that conversation in an organic way that follows, the way that the person using the service sort of wants to speak to, what's going on for them. The crisis supporters are applying these 4 sort of steps, and the first one, in terms of this particular discussion about loneliness, as I sort of spoke to earlier, is connect, and that is fundamental. Nothing else flows until that connection is formed. So the crisis supporters are sharply focused, particularly in the early stages, but also throughout that conversation, be it via voice or chat or text, with the service user, in establishing and maintaining a connection. Now, that connection, is the basis from which that befriending element of crisis support is provided. So it's about making sure that the person using the service knows that they're being heard, seen, and also associated with that is that sense of belonging, and that, and from that, the willingness to open up and engage and discuss the particular subject matter that's on their mind. So, essentially, it's not specific to loneliness calls. It applies in the case of those people experiencing loneliness, that the crisis supporter will ensure that there's connection front and center as a focus in the conversation, and that connection's maintained throughout. And that's a key part in de-escalating crisis and and having the outcomes that our services, our helpline suites, are designed to have.
There's a thread here around from Nicholas around brain change dimensions. So I guess looking at those, yeah, there's some questions there around, have there been any evidence or research presented or any awareness around loneliness and brain change dimensions? It's gone back to medical model a little bit, but has anyone got any commentary around that?
Out of my depth on that one, I'm afraid.
There is quite a few articles that Nicholas has put out there in terms of evidence that is sitting in that space. So I'll leave that if nobody else has any commentary around it. Let me think. There's quite a few comments around affordability, housing crisis. This might go back to you, Sarah, in terms of what you heard, that things that are leading to loneliness are things like, yes, we heard about DFE, but yeah, housing and the housing crisis and homelessness, single parents, all those kind of things. Is there any comments that you'd like to make around that?
Yeah, I think I saw those comments coming through, and I think all of them really speak to some of the key bits of evidence we took, and honestly, some of the most vexed in terms of how we deal with that. And this is that reasoning, I guess, as to why it's a whole of government strategy that's required. Clearly, housing issues. I mean, just the stress alone of housing, the expense of housing, the difficulty in finding housing, the stress of that alone puts pressure on relationships, let alone if you're already struggling a bit with connections in that space. So housing, I mean, you all probably, follow as much as I do, all of the discussion around policy and what we're trying to do in the housing space. I think part of the role of this inquiry, and we've heard it from Dr. Brooks and others, is making sure that when we're thinking of those policy areas, that we also can, there's an awareness of the role that is played in things like loneliness and social isolation. So it's not just, the sort of first level obvious kind of things that you're trying to solve, those basic needs, but those basic needs very much play into all of those impacts that we've spoken about today. And I think that's the role of that sort of cross-government aspect. Clearly, we're trying to move stuff on housing. Sometimes that works, sometimes it's not, but we're really trying. But I think married with that needs to be an awareness of its impact on this kind of issue, and it's, I guess, the health and well-being in terms of social connection and other outcomes. So I think that's important. I think the cost of living issue, I mean, yes, of course, and again, that's a multidimensional, multi-jurisdictional issue. But again, being able to clearly articulate in the way that our panelists have today, how that impacts on the experience of people, and how that further, impacts on the health system, on other pressures that we are also trying to deal with in the policy space. So I think. Yes, really important, very difficult to deal with from this space as the answer, but really, really emphasises why that cross-policy, cross-agency, cross-portfolio approach is one that needs to be properly considered.
Thanks, Sarah. This one might be good for you, Elizabeth, and it's a heightened environment globally that we live in at the moment. How can we better support people who experience loneliness as a result of their political beliefs or affiliations? In an era of increasing political polarization, many people are finding it difficult to maintain relationships with those who hold opposing views. This divide is appearing to lead to significant social withdrawal, strained family dynamics, and a sense of isolation. Just a small issue to try and resolve.
It's a big topic, and it's actually one that we've been, I think, as a society thinking about a lot more since the pandemic, because we first started to discuss this around the anti-vaxxers, and there was a lot of, I was doing a lot of sort of engagement and commentary around, what do you do when you find you've got family members who have different views to you, and it has all sorts of implications around literally being able to meet up. And so I think since then, and now we're having waves around politics, it does raise really interesting questions about how much difference and discontent we can experience in relationships before the relationship flounders. Because really there is no relationship where you have everything in common at all times. So managing separateness and togetherness, connection and disconnection are the themes of life, really. Even, to really not be too banal, but even just different standards of tidiness in the house or different appetites for seeing friends versus being at home. We manage difference all the time. So to be successful in relationships, we have to skillfully navigate how we hold ourselves in relation to others' differences. Now, when they get more extreme, as we found during the pandemic, I had so many people say to me, I've found things out about people I didn't want to find out. And if it wasn't for a pandemic, I never would have even had this conversation. And I'm hearing that now. I didn't even know I had an interest in global politics, and suddenly I find I do, or I find others do and want to draw me into it. So I think what this raises for us is first of all, just to remember that differences are the stuff of relationships. So to not be thrown by it. But certainly it does raise more tension. It raises points of self-reflection, which is how much difference do I need to tolerate? And what is the threat to me if someone is so different to me? Like, why am I bothered? So first of all, do some reflection. Why am I bothered? Do I need to be right? Do I need to make sure that this turns out my way? So just get in touch with what is driving you to feel so righteous and indignant. But also, if the relationship is valuable to you because you are in connection, maybe it's a family member or a loved one, is instead to focus on the connection. So it may be this person has extreme views because they're fearful for their family, or this person has extreme views because they feel personally threatened because they have a trauma background, or whatever it might be. Try and make sense of their heightened experience. Usually if you connect with that, you can feel much calmer. So even if you don't agree with the outcome, you have deeper understanding or even a compassionate understanding of why they're there. But secondarily, if you're stuck, just remember why they're valuable to you in every other way. And sometimes choosing to work around those issues, if it's your great Uncle Fred and you only see him 4 times a year, sometimes just maintaining seeing him is really worth doing.
Evelina, can I just jump in? It's obviously not along the same professional lines and wisdom that Elizabeth just gave, but a colleague of mine in the committee sent me a couple of articles when we're talking about politics and loneliness that have researched and consider the link between loneliness and populist right-wing political movements. And making the links that when people feel lonely in one aspect of their lives, some of the attractiveness we see and maybe don't understand about some of that more extreme kind of political engagement is because there could indeed be a sense of belonging amongst that kind of cohort. So some really interesting connections and research being done about, I guess, the reverse, not what someone's politics is and how we cope with that, but how someone's politics might be shaped by the experience of loneliness and perhaps drive them towards more extreme types of political engagement, which I just think is a fascinating kind of, I know nothing about it beyond seeing these articles, but is really interesting given what we're seeing around the world.
Yeah,
I think that's almost a topic in itself. Sorry, Elizabeth.
Well, yes, I see Michael's put in the chat about the incel subculture. I was going to say the same about the effect on young boys and young men. About grouping together around masculinity. And so much of it is about finding the people that you connect with. The topic can be almost less relevant to you than feeling deeply understood, which is just such a primitive need.
So important.
And I mean, I come from the Labor Party, so we very much understand what it's like to feel part of a tribe. So it's a really fascinating area.
Yeah.
Okay, I don't know who wants to pick up this one. It's actually about findings, so I think it's for you, Sarah, but I'll open it up to everyone to comment on the whole debate about digital versus in-person support when we talk about loneliness. And I'd have to say now, throw in the world of AI, and you've got a different level of digital support. So digital versus in-person, just any commentary. Might go through Sarah and then Anna and then Elizabeth. Thanks.
We heard really interesting evidence on this from across sort of demographic groups, and also, I guess, for and against. So, and from young people who talked about the positive aspect of being connected and how that's a key part of how they, interact and understand each other, but also, I guess, and this from I guess not so much evidence as a researcher. I'll give you, just an anecdote. Is I'm talking to my daughter about this 24-year-old, saying she has a breadth of connections, but not a depth. And that did come out a bit, which is you can so easily stay connected to everyone you've ever met, but that the quality of those relationships is something to be considered. The other thing, though, that again I'm running a simultaneous inquiry into the harmful effects of pornography. And again, that was very much about this online existence and how much time we spend and whether this is a good or bad thing. And I just think we don't understand enough. And one of the things that I've been saying is the digital world and platforms are so far ahead of where we are in our thinking, and we are just struggling to keep up. And maybe Anna and Elizabeth have answers as to how they deal with it, but I don't think from a policy place that we are anywhere near, or maybe as a parent either, that we are anywhere near being able to keep up with the changes, including all of that kind of AI. In saying that, as I mentioned, there were some fascinating witnesses and research and evidence being done about the potential for AI to combat loneliness in terms of engagement with avatars. And while this was quite confronting, as I said, to some of us who are like, well, we don't want to displace human, and of course we don't, but I think there is a role to augment human interactions with AI that's sensibly created. Particularly, we saw some really fascinating. I went out and did a visit to UNSW, the work they're doing there on AI for people with dementia, which was really fascinating. So I think it's a very boring answer that there are some pros and cons. Not very helpful on that one.
No, not at all. It's all insight. Anna.
Thank you. So, look, I think in terms of AI, I'm not sure. I put the link in the chat, but a Harvard paper came out the other day about use cases of AI, and the number one use case now is therapeutic. So that is incredibly interesting, I think, and some related papers around, people being unable to discriminate whether the therapy that they were receiving was from a human or from artificial intelligence, and in some cases preferring the experience when they're engaging with AI. So I also think there's a lot of scope, but I'm also cautious. I think, governance around that, and, making sure that, where AI is applied, that it's transparently applied, and that it's ethically applied. All those sorts of things are, like that. That's the technology has screamed ahead of where we are in terms of actually making sure that it's properly governed. So that's a sort of a significant note of caution. In terms of Lifeline, we're very conscious. Our helpline suite is all about hope through human connection. So that will always be the case. Our crisis supporters will always be, real life people. Whether there's opportunities for us maybe in training or in some of the back of house sort of non service user facing environments for us to apply AI is a different question. But the heart of what it is that we do will continue to be based on humans, just to make that really clear. So I think AI is a really interesting space and one that we will watch very closely. In terms of the broader sector, suicide prevention, and also mental health more broadly. In terms of digital versus face-to-face service delivery, I think, look, and I'm going to sit on the fence, but I think for good reason. One of the things that's very clear to us, and this is across our suite of services, is that providing different opportunities for people to engage in a way that works for them at the time that they need to engage is really important. So the Eclipse program that I mentioned earlier for people who've attempted suicide, that's typically offered face-to-face on a face-to-face format, but we've also trialed and done some really deep diving into what that looks like to deliver online. And for some people who experience the online option, they actually find that, and we've sort of compared across those different offerings. Some people prefer to have that digital experience of service provision, and that can change over time, even for the individual. So I think one of the things that we're really committed to, as I mentioned in my talk, that we consider ourselves to be one of the services that's like a wide open front door. If people can enter through Lifeline, and then we're able to refer them on to additional services where appropriate, that's terrific. And so our addition of service offerings like the chat and text service is all designed to create more opportunities for people to engage in a way that works for them. We know that in the case of the text service, like people who would never have used the voice-based service have engaged in numbers, particularly young people and people experiencing domestic and family violence. For the latter group, being able to communicate without being overheard, really important. So I guess from the Lifeline perspective, providing different opportunities.
Oh, sorry. Okay, we'll keep going. Elizabeth, over to you around digital versus in-person.
Yeah, look, just very quickly. So a sort of a stark example that we've found that, for example, running groups for single mums on parenting issues, so many have told us that if it wasn't online, they'd never have made it because they can't afford the babysitter, they can't afford the time to drive across town, they have no idea how to even juggle everybody, and they have loved the fact that we have increased accessibility. The downside is, of course, for people who are lonely and need to make new connections, if it was run at a particular venue, they'd leave the building together and they might go out for coffee. So, I think what we have to do as service providers is make sure that we don't collapse into convenience, and that with our funding challenges, which are very great, that we don't end up delivering the only thing we can afford to deliver or the only cheap solution, because you can certainly get a lot of bang for buck with online, but if we're really going to be responsive to communities, we simply have to keep leaving room for what now looks like the more expensive option, which is helping people meet 3D with each other.
Oh, so well said, Elizabeth. And I think, it's horses for horses. That's what we talk about, individualistic care, and what works for one person doesn't work for another. So having multiple services in multiple forms is what works best. I'm just going to pick up a comment that was made, because some of these community-based initiatives or frontline offerings, while they might be seen as funny, anyway, Elizabeth says, I think we need government-funded laundromats that also have a kitten cafe added to them. And it's, that community-based. I loved it too. That's why I picked on it. So perfect. Thank you, Elizabeth.
Perfect.
Now we've only got a few minutes left, so I just want to leave you each with maybe 30 seconds each if you had some final comments to make before I kind of draw it to a close. Dr. Kane, do you have any final comments that you wish to make?
Look, the first thing I want to do is say thank you to all of you on the panel, but particularly to all of you who are online, who are doing such important work for so many people. And I know on so little money, a lot of time, and I appreciate it. And I'm very happy. I can see questions in the chat. Very happy either for Evelini to send those through that are for me, and I can send them back and you can distribute. But alternatively, if you just flick me an email to my office, happy to engage with you on any of the questions that you have or any of the things we've spoken about today, or in fact come in and have a cup of tea with me and let me know what's happening for you and your organisation. I'd be very happy to do that. We'll try and come up with a really thoughtful report which reflects the kinds of things we've heard today and reflects the expert advice and research and evidence we've heard from Dr. Brooks and Elizabeth and others. And rest assured, when we have those recommendations, you may come to Parliament any day and see me running down corridors chasing ministers. So, but please do get in touch with me if you want to have further discussions on this issue or anything else that the Social Issues Committee is working on, which may intersect. The Social Issues Committee is probably going to intersect with other things that affect this cohort of the community as well. So thank you. I just want to say thank you again for all the work you do. And thank you for having me.
Thank you so much, Dr. Kane. I mean, we'll continue to poke the bear, as I'm sure you will, in order to get momentum. I'm just acknowledging there's a few comments in the Q&A around aged care and loneliness. We clearly won't have enough time to cover it, but maybe Dr. Brooks and Elizabeth, you can help us with providing us any information. We can circulate that post the event. Any final quick comment from you, Elizabeth?
Oh, look, only that really I love the laundromat idea. I'd really encourage people to look up the Neighbours Everyday campaign, because it really is looking at that, a non-shaming way to meet, have a common purpose, a common moment, and just hang out. That's where a lot of these things start. Doesn't have to be fancier than that, but we do have to remember that being visible, being noticed, being remembered, these are foundational, and sometimes it can be a barista or whatever it is going to be meaningful. So don't underestimate those as well.
Thanks, Elizabeth. And I'm going to save you, Anna, because I know you're recovering from a cold and I'm conscious of our time. Loneliness is a silent epidemic, but it's one that we can fight together. Imagine a world where every person feels seen, heard and connected. The power to make that world a reality starts with us today. So let us be the change we wish to see. As a thoughtful takeaway, how about we all reach out to 5 people, whether they're friends we haven't connected with for a while or individuals we don't even know. Similar to the acts of kindness, let's initiate an acts of meaningful connection. Please join me in thanking our wonderful presenters, the Honourable Dr. Sarah Kane, MLC, Elizabeth Shaw and Dr. Anna Brooks. Thank you for sharing your insights and for taking the time to be with us today. The webinar recording and speaker presentation slides will be available in a few days from our MHCC website. And of course, we will email all our attendees. You will receive a short survey after the webinar, so please take a moment to let us know how you found the session, and any feedback helps us to continue to deliver these wonderful webinars at a high level. Thank you for being with us today, and that draws our webinar today to a close. Thank you very much for your time.